Let me start off by saying welcome back to the Prime Minister. It's good to have the captain back on board, and the country seriously needs leadership. Welcome to Arm Wrestling with COVID-19 in London. This is number 15. Earlier today, I went out for my daily constitutional. Something like half an hour, 45 minutes of walking and then popping into a supermarket to buy a couple of things. And what struck me today, as has struck me over the past few days too, are the number of people on the roads walking, as well as the cars. Now it's interesting because if I compare this with, say, 1 or 2 weeks ago, the numbers have certainly increased. Some of it could have been attributed to the glorious weather that we had, ironically enough, in the past 10 days. But I think it's more than that. And there are more people, there are more cars. And not only the numbers. Look at physical distancing. If you've been walking these few days, I'm sure you will have noticed it too. The physical distancing, what is referred to as social distancing, isn't really happening meticulously. And those people who are having their masks on, they're hardly covering their mouths and their noses, at best their mouths, or they're hanging around their necks or on their chins. A bit worrying, isn't it? And if you go into the supermarket itself, again, going back to a couple of weeks ago, you would see long queues outside the various shops, those that are open at least, supermarkets, chemist shops, booths, etc. There would be lots of people waiting outside and they would trickle in one at a time or two at a time. These few days, whenever I've dropped into a supermarket or a shop, there is no way that you can maintain physical distancing. And I've been told by good friends, and I do have a few of those as well, they've told me, Harry, go and have a look at the trains in the morning during peak hours. They're still peak hours, despite all the wonderful advice that is being given by the government, by Public Health England, by Transport TfL. People are still on those buses and on those trains, and that proximity is what worries me. Now, I seriously do welcome the urging by the government and by Prime Minister Boris Johnson today that the lockdown will continue for a while. It's good because I was getting a bit worried that the trade-off between economy and health was getting perilously close to, you know what I mean. But he said today quite clearly, probably born out of his own experience as he struggled with life and death issues at St. Thomas Hospital only a couple of weeks ago, that the lockdown will continue because we cannot risk to let go of all the gains that we have achieved as a country, as 4 nations, as a society, by just saying, okay, it's time now to go back to work. That is good. I am happy with that, and I know that the new Labour Party leadership, a lot of the medical and scientific advisors are also counseling for that to happen. However, for me, there is a very single proviso, a very simple proviso. Lockdown in itself is not the answer. You keep locking people in their flats, in their houses. You keep telling them, stay in, it's for your own safety. This is what we need to do. But what is the outcome? What is the way out? What is the solution? What are you doing? Are you basically telling people stay here forever and a day until such time as the vaccine comes? And if not, what are you doing? This is why I keep coming back mantra-like to my own point, which is that testing should be really taken seriously. First, testing for those people who have the virus and those who don't, like Germany has done and is doing, like other countries have done and are doing still, testing to see whether the virus is being carried by people. And secondly, and equally importantly, another kind of testing to see whether some people have developed antigens or antibodies. Because what happens then, if you know who has the virus, who doesn't have the virus, who has antibodies, no matter how long those antibodies would last and protect the people, no matter whether they are in the majority or the minority, regardless of such silly concepts at this stage of herd immunity and what have you, once you can do those three categories, then it would, in my opinion, be much easier to devise a scheme, a way out of this predicament that we're all facing. And a way out is actually the second part of this formula. I'm not only saying lockdown is not enough on its own, it has to be accompanied by severe and relentless testing, both of the virus and the antibodies. But the government should really show us a pathway out of this predicament, not only for psychological reasons, but because it cannot continue the way it has been going on for the last 3+ weeks. I mean, you've heard the news. Domestic abuse is dangerously on the rise. There are issues, mental issues. People are having to grapple with the lockdown, with the fear of getting this virus. So if you say, okay, you need lockdown now, and the British people are pragmatic, they understand, and I've been told over and over again that the majority of the people are following the guidance, although the minority is spoiling it, the lockdown is fine. Add to that the testing of viruses, who has it, who carries it, who doesn't have it, who has antibodies, who doesn't have it, and then devise, show, indicate the pathway out of this so that people can actually begin to have hope that at the end of this very tumultuous, very uncertain, very difficult, very stressful period, we would actually have something to show for. And you know what we have to show for it then? Our own safety, our own security, our own health, ultimately, our own lives, when we have tens of thousands of people who have already died in this country. This is all I'm saying. I'm not reinventing the wheel. I'm not being intelligent. I'm not trying to be clever. All I'm doing is basically using some common sense that a lot of politicians, a lot of ministers, a lot of people, if they stop spinning, if they stop stonewalling, I think deep in their minds, they would agree that what I'm saying is not silly, is not a bunch of idiotic ideas. That's all that I have to say. A formula which is a three-pronged formula, lockdown, two kinds of testing, and a pathway, or don't call it an exit strategy, ministers are allergic to that, and a pathway out of this predicament. And just to finish off, on a light note, perhaps, let me also share with you something that made me smile quite a bit today. I was talking to a colleague of mine online, and he told me that apparently a paper was published in Australia, down under, saying that flatulence, passing wind, or what is commonly known as farting, is contagious if you have the disease, the virus. So guess what? Masks become even more essential, perhaps with a whiff of perfume. Take care, stay safe, and Until number 16, I suppose. Good night.